Hi everyone, my name is Miguel and I'll be walking you through my research intervention, which aims to examine the effects of supplementing adolescents inpatient behavioral health treatment plans with expressive writing. So, just as a brief background, my internship site is at Chicago Children's Center for Behavioral Health, which is an inpatient behavioral health facility that works with youth ages 3 to 17 years old. Patients are hospitalized for many reasons. However, depression, self harming behaviors, suicide attempts, and suicidal ideation are the most common presenting concerns. Currently, patients engage in program with therapists through group, individual, and family counseling, and they're only given a stress ball, a journal, and markers due to the facility's restrictive environment. The journals are encouraged by staff for patients to keep track of daily thoughts or to use as a free writing tool. However, I don't believe they are fully utilized by the therapy team. The purpose of my intervention is to measure the outcome of incorporating expressive writing into patients' current treatment plans. Expressive writing is defined as a technique whereby individuals engage in deep and meaningful writing about a traumatic or troubling event. Expressive writing is an activity that can be implemented by almost any willing participant, and it's been shown to improve immune function, increase psychological well being, and reduce medical visits, anxiety, and depressive symptoms. The current literature suggests that expressive writing may be a useful tool to supplement therapy. Expressive writing allows people to have better adjustment across emotional, cognitive, and exposure based domains, and as a result, individuals experience catharsis, have improved mental processing, and increased resilience when dealing with negative experiences. Greenbaum and Javdani examined multiple studies on expressive writing and found that the benefits seemed to be greater for those who wrote about a previously undisclosed trauma, those who are more inhibited, have less opportunity for confiding in others, or belong to a stigmatized social group. The target population for this intervention are male and female adolescent patients in an inpatient behavioral health program. The intervention requires a certain level of cognitive processing abilities, so this may exclude some individuals from participating. The sample size would be determined by the number of new admissions at the hospital. An average caseload for interns is about 2 to 3 patients a week, and working with them throughout their stay until they're discharged. I do want to note that although therapists interact with almost all patients due to group programming, the intervention would only be offered to the new patients assigned to the person leading the intervention. The intervention procedure includes 3 options. The first option would be writing a letter addressed to someone significant in their present, either someone supportive or someone who contributes to the reason why they were admitted. Ideally, the letter would be written in the first few days of treatment. In about 2 to 3 days of being discharged, patients would then write a letter and address it to their future selves, emphasizing their current insight and how they will use it to supplement their aftercare treatment. The follow up letter would also incorporate patients' expression of gratitude. In the second option, patients would be assigned 2 to 3 self reflection prompts during their stay, and emphasis would be placed on examples of them coping with past difficulties and, again, expression of gratitude. If patients are interested in neither option, they could elect to complete a daily mood tracker and journal entries that provide daily reflections of their thoughts, emotions, and behaviors. This is similar to what already usually happens during patients' treatment, so this would be considered the control group to compare the data. Participant data would be collected during check-in points during individual therapy sessions. The therapist would check for completion of the activity and their level of engagement. Some reflection questions that they could ask can be, how did you like the activity? What thoughts or urges did you notice while completing or reflecting on the activity? Or how was your perspective changed on your presenting problem based on what you wrote? A Likert scale would be used to measure the patient's suicidal ideation, homicidal ideation, and daily mood to compare against what was reported during admission. And for more standardized measures, the Columbia Suicide Severity Rating Scale or Beck's Depression Inventory can also be used to monitor patients' change in symptoms. So this intervention has a few possible limitations, including the lack of implementation due to COVID-19, so we couldn't collect any data to measure any outcomes. Even with data, the sample size would be too small and inconsistent to produce valid results, meaning that it affects the generalizability of the findings to the wider population. Another limitation is the setting, which is an acute psychiatric program, meaning individuals may not have the space to process the intervention because they're still experiencing crisis. And also, individuals have discharge requirement they need to complete, so some might participate just to fulfill those requirements. And lastly, expressive writing may already be a coping skill that patients engaged in prior to admission, so their outcomes may not match what would have been expected if they weren't already familiar with the intervention. Thank you for taking the time to learn about this intervention. And so I'll leave you with these references, and I welcome any comments, questions, or feedback about the intervention and the presentation overall.